Cheryl Fox is today's speaker. She was born and raised here in Sonoma County. She's been in healthcare for her entire life. And she graduated from the junior college here with a degree in vocational nursing, and later got an associate's degree in nursing from the University of New York. Cheryl's healthcare career has spanned over 50 years, and she's worked for most corporate healthcare entities, and in 2005 started her own business out of the trunk of her car, and now she has over 100 employees providing in-home care, and in 2021 opened the Fox Home Health Vocational Training. During the pandemic, they worked closely with Sonoma County Department of Health and managed the Roseland Clinic. They also provided vaccines to the unsheltered and homebound individuals, and by February of 2022, Fox was responsible for giving over 60,000 vaccines and performing over 40,000 COVID tests throughout Sonoma County. Cheryl, come on up. Way cool.
It's way cool. And I know some of you. I know some of your faces because I'm a past board member for you. Pandemic kind of got away from me and had other focuses I had to address, and so it pulled me away from being a board member. And I've missed it. I've missed being able to feel as though I was a part of the community and able to give back to you in the way you deserve to. So, as Pete was saying, in 2005. After 32 years of working for one of the favorite healthcare systems in Sonoma County, I decided I didn't know if I could do it better, but I knew I could do it different, and I retired and opened, actually at that time it was called Fox Wellness Case Management. Very little background in business, I must say. A lot of background in being a nurse, in that Florence Nightingale and I were twins. And one of my grandnieces actually asked me the other day if it's true that my spirit animal is now extinct. This is my 57th year of nursing, right out of kindergarten. And I've seen a lot of changes and been very, very concerned. When people talk about how our healthcare system is about to crumble, I look at them and think, you're not watching, it's already there. There's so little available in our community, trying to find doctors, being able to get into facilities, being able to get testing done is becoming more and more difficult. So I've tried to incorporate that into some of the work that we do, trying to be creative and inventive about how care can actually be provided for people through our home care agency. And I'm just realizing that I'm rambling and not paying attention to this thing that I worked on for you, but I'll get back to it, I promise. So during the pandemic, one of the biggest things that really concerned me was we were providing for the unserved or underserved in our community on one hand, and on the other hand, we were seeing people leave healthcare in groves. Who wouldn't? The chances of going to work and contracting a disease that you could take home to your family, and early on nobody knew exactly what that was going to mean. It was life-threatening, if we all remember. And to see these, on the other side, people who are unserved or underserved, who would make wonderful healthcare providers in any way they could, I thought we've got to be creative about this, because nobody's doing anything in our community to kind of even this out. So I made a little extra money from what we were doing with the vaccines, and I thought, I'm not giving it back to the government. As much as I love our country, I wasn't pleased with what our government was actually doing with our funds. So I started a nonprofit called Fox Pacific Academy, and there's brochures at the back of the room if you're interested. But And I put the money in there, and then I rented the Red Cross building, and I hired some instructors, and we started training people to be nursing assistants, and went through the state to get all the certifications so that once they were nursing assistants, they could go on and take the certification program and become certified nursing assistants, which would allow them to have a livable wage and their foot on the pathway towards healthcare. I get goosebumps when I think about this. A company in San Leandro, I believe called Empowered Aging, heard about what I was doing. It aligned with what they were doing, and they had written a grant from the state of California for $5 million. They asked if we would be willing to partner, which we did, and they have given us a grant for $1 million over 3 years, and we've already graduated about 300 people who've gone on to become certified nursing assistants. And I always get choked up when I say that because how I started nursing was so bizarre, but we could have a glass of champagne someday and go over that boring story. But anyway, so I'm hoping that we're making not only a difference in healthcare in Sonoma County for everyone, but that we're making the difference in lives for the people that come to our school. We've since gone on to become certified by the Redwood Food Bank, so now we are a food distribution center, so all of our students have access to food at school every Monday when we do our professional development portion of our program, which is wonderful. And everybody has their uniforms, everybody has all the equipment they need to go to the bedside, and this week we just found out we've become a regional testing site, so people don't have to travel to Sassoon or Fairfax to actually complete their certification. And it won't be just for our program, it will be for the region. So we're hoping to get people in there and certified and to work, for God's sakes. Somebody else should be paying taxes besides us and have a wonderful career, which to me, nursing over the 57 years has just provided me with a purpose in life that has just been phenomenal. I'm just really pleased about it. So I'm hoping this is going to be more open discussion than you're just having to listen to me talk about what excites me in life. And that hopefully I can share with you some information that will improve the quality of your life and at least, the very least, a knowledge base. So if it comes to the point where you have to decide about what am I going to do here, that you have that knowledge and or you have a phone number to call, and either myself or one of my employees will be more than happy to talk with you about what your consideration needs to be. So Fox and Associates was Fox Wellness Case Management, then I shortened it to Fox and Associates, and now it's just Fox Home Health. But as I said, I had no business background, and all I could see was I needed to do what I need to do. So one night about midnight, I was starting the program, and I thought I probably really need to be a corporation of some sort in order to protect my own self. And I went on the internet, and it was called LegalZoom, and I couldn't decide whether I should be an S Corp or I should be an LLC or anything else. But that night they were having a sale on S Corp that was a leather binder, well, a fake leather binder, as opposed to a vinyl binder, and that just made sense to me. So we became an S Corp. And then the other thing was, I would need to draw in customers, and I knew that everybody would get, like when you go to a hospital or a skilled facility and you're being discharged, they give you a sheet of paper that has listings for names of who you can call out for help. And if they're Medicare certified, they have to give you at least 3 names. Well, I wanted to be at the top of the list. And there was somebody else, and the name of their corporation starts with @ So I needed to go with an A, and then what comes next? So I had to make a very difficult decision as to whether I should become Advocacy Home Health Incorporated, or Aardvark. And I chose advocacy because I just thought people would understand that a little bit better. So after being in business for a while, we became licensed by the Department of Public Health, not the Department of Consumer Affairs, so that I could provide both skilled nursing services and physical therapy services, as well as nursing services. Now, the difference being is that you have to be licensed the same way as Medicare, certified, everything across the board, but we are private pay. It provides you with, and it's not, of course I want you to come to my agency. No two ways about it. If you look at the sheet of paper I handed you, it's probably 3/4 of the page is about Fox Home Health, but I guess that's because I'm kind of a proud mama, and just want you to know. But this is what you should be able to expect from a private duty agency that is licensed through the Department of Public Health. I've listed all the things that we can do. We work under the direct supervision of an MD when it's considered skilled care, but we do not need permission from a physician to provide you with caregiving services. One of the things you need to look for in home care, whether it be through me or anyone else, but if you're using this type of service, that they're really training their staff and they're training them well. As you know, with Parkinson's, it can be very devastating, and the amount of care that you need can vary from day to day. So if you are going to be hiring a private duty agency, you're going to want to make sure that they are trained in being able to meet whatever need that you have, whether it be simple transfer or whether it be a more complicated transfer like with a Hoyer lift. You don't want somebody necessarily learning at your bedside. And for the price that you will pay, you do not deserve to pay that price for somebody who's trying to learn at your bedside. So we, again, if you don't have one of these, Dave back there has them and he'll give you a copy. But we have a list of services that we provide that also include, if you have long-term care, and any agency should be able to help you with this, if you have long-term care insurance, then there's a hope that your agency will be able to help you implement that long-term care. They oftentimes require you to have a certain period of time before that the long-term care insurance will kick in. So your agency should be able to help you with that, and they should be able to help you with the billing of the long-term care agency after that. We have both caregivers and nurses who are trained in being able to assist with end-of-life care. We often have times when it's truly end of life is when the caregivers are definitely going to need their respite, believe me. As much as we love people, we love our family, our spouse, you can't do it alone. You should not have to do it alone. Quite frankly, I bury as many caregivers as I do clients, because oftentimes they become so exhausted by not only the feeling of the responsibility of taking care of your loved one, but it wears on our body to a point where new conditions and new situations will arise. And that's not healthy for anyone. So being able to connect with either an individual, a group of caregivers, whatever, to help you at any time is important, but especially at end of life. That can be so devastating. One of the things with end of life that is also really important to know is that in the state of California, we have a law that allows choice around death and dying, and choice as to when that's actually going to occur. I'll just be really brief about this. It's a very tender subject, I know. But if a person has a diagnosis that would indicate they have 6 months to live or less, they are eligible to go through the dignity with death provision that was implemented in 2016. And you deserve to have the support that would help you accomplish that task. be more than glad to come back and talk to you about this in depth. I have assisted on a number of occasions and been there holding hands of family members as well as those who are passing. It happens to be just a little bit of history about me. As I said, I was on the board of the Parkinson's group for a number of years. I think it was 2 or 3 at least. And after I left the group, I fell in love with a gentleman with Parkinson's, and I never thought that I would be able to help with dignity in death. And that was probably one of the most gracious and peaceful and loving things I ever did for Gabriel. And I wish that it could have been way different, but it's certainly something worth talking about if you've thought about it. And it's certainly something to know that you have an option for. And then I would also say that having done hospice for a number of years, that the actual act of the dignity with death takes a lot of courage. And not that anybody who would choose to die a natural death doesn't have courage, but if you have a really great hospice nurse, much of what can be accomplished, I'm not saying that they would overdose you or give you medication that you shouldn't be having, etc. But a good hospice nurse will provide that dignity with death, as well as provide that dignity with death for your family. It's a family affair, that's for sure. And Fox Home Health also has recently added wheelchair transports, and I think we're one of the most reasonable rates in Sonoma County. But I wanted you to know about that, so that's why it's listed here.
Can you describe what wheelchair transport is?
Yes, we have two vans that have a ramp, and so we can actually help to put somebody into the wheelchair and then into our ramp. All of our drivers are have special training to make sure that they're safe drivers, but they're not just drivers. They're also either certified home health aides or nursing assistants, so that it's not, you don't just have a driver, you have a skilled professional being able to provide that transport. We can go to or from doctor's appointments. We've been able to actually transport people from Santa Rosa down to UCSF and CPMC. So sometimes it's more difficult in the longer visits. But again, and then you have someone who's skilled to be able to be with you to go through those meetings. There's also Medicare certified home health. This is a little more difficult to access, but it should be covered by both your Medicare and your secondary insurance. It's considered short-term and intermittent, and it's goal-oriented, which means that, and you need to be, see, let me think if I can, I'm sure I can come up with the term. The term is you have to have difficulty leaving your home, a great deal of difficulty leaving the home, and usually this is ordered after a hospitalization, whether it be acute care or subacute care, and there needs to be change in your condition. So what will happen is either a nurse or a physical therapist will come to your home, and they will determine what your needs are and work with you and your family to develop goals. So say you're coming home and you have a new medication regime, you may have a short stay with a nurse coming to your house once or twice a week to make sure that you and or your family member are able to administer the new drugs, the medication regime as it has been in the past. And then the nurse kind of falls off the list. And the physical therapist or occupational therapist, again, they will set goals, and once you're able to perform adequately to meet those goals, then they will also discharge you from service. Now, just a little insight about this is that Medicare is on a prospective pay. So what happens is the government will pay them for your short-term intermittent care based on the meeting of those goals. And the agency itself is paid under the prospective pay. So if you're admitted with a diagnosis of congestive heart failure, they get a pot of money that would go with congestive heart failure, as opposed to if you're being admitted with a knee replacement. So it's to the benefit of the agency to get in there and provide you with the service you need and get out of there as quickly as possible. So the certification period for Medicare is 62 days for home health, and they will do whatever they possibly can, hopefully keeping you as safe as possible and giving you the knowledge that you need to be able to get in there and get out of there as quickly as possible. Because the sooner they're out of there, the more money they're able to hold on to. It's a business decision, it's not my decision. So they do provide nursing, physical therapy, occupational therapist. They'll provide a home health aide and a social worker that could help you with meeting your needs. But again, their goal, unlike what someone like me would want to do, because they're a business and I'm just somebody out there doing this work, their goal is to get you on service and get you off service as quickly as possible with the most defining diagnosis possible because of their reimbursement. So know that that's where they're coming from and work with them on that, because you're all very bright people. You're here to learn more and to be more. And there's always a way to work the system. And I encourage you to do so, because you deserve all that you can get to be able to stay as healthy, as independent as possible. Yes, sir.
So what strategies are there to work the system? What does that mean?
One of my favorite terms is patient safety issue.
Mm-hmm.
Keep that in mind. That's a really great one. And to try to negotiate with the care provider that's coming into your home to see if you can't get them to buy into the patient safety issues and or concerns that your family might have related to the safety issues, so that you can get care extended as much as possible. Remember though, the term is short-term and intermittent. So their goal will be to come in and provide for you. And again, I'm a healthcare provider, been forever, as I said. That person may not be the one who wants to get in and get out of there as quickly as possible. But the people who are running their business will want them in and out of there as soon as possible. So work with them, see what you can see. And would I be willing to consult or have one of my staff consult? Of course, you know. The other thing is something such as in-home IV therapy. So what happens in our age group is that you go to the hospital, they determine that you need long-term IV antibiotic therapy. Your choice is that Medicare will pay for 1 or 2 nursing visits a week. Now, there's training, and everyone can be trained to do IV therapy. It's very different at home than it is in the hospital. Different in that the method of delivery can be something as simple as what they hang a bag to go in over an hour can actually be put into a syringe, connected to the line, and go in over a few minutes. It's much nicer. Or they have other devices that don't entail a plug-in machine. But Medicare won't pay for somebody to go in every day to handle that dose. So you could actually use the Medicare for the 2 days a week to do your dressing change and do the blood draw that goes along with IV therapy, and you can hire Fox Home Health to come in, and a very skilled nurse can come in to do the dosing if you or your family member doesn't feel comfortable in doing that. Unfortunately, because Medicare is in there won't be another insurance that will cover that unless you have really super long-term care insurance. But we can, let's make a deal, kind of a thing, so that you're able to be in your home. I'm a firm believer that people heal more quickly and more comfortably in their own home environment. an environment of comfort than they do in a hospital setting, regardless how beautiful that hospital is or how good that care is. So it's a consideration, certainly a consideration. Hospice care. Well, you know, what's that old saying? The only thing that any of us are really sure of is that we're going to end up paying taxes and we're going to end up dying. So hospice is really lovely. And it too has changed over the years, as has everything. It is a government reimbursable option. And because it's a government reimbursable option, of course, the payment and how people get paid and how they don't get paid gets switched around so that my God, am I showing how liberal I am? So that the reimbursement to the company is more satisfactory, not necessarily as satisfactory to the person receiving the care. But I know a lot of hospice nurses, and I've worked with every hospice in Sonoma County, and I love them all, and they do the best they can with what they have available. So to enter into hospice care, you need a physician to say that they think that the individual has 6 months or less to live. And the focus for care becomes comfort care only. So there's no going back and forth to the hospital. Chemotherapy can be given, but only if it's a matter of feeling like it's going to be part of comfort. So unfortunately, if you have a cancer and the tumor is in such a place that they believe it's going to cause pain, they may approve the use of chemotherapy. They may approve a transfusion once or twice, depending on the situation, because of the fact that when someone's blood levels drop to a certain point, it's really uncomfortable. The breathing can be uncomfortable. But they will work with you towards other methods of alleviating the stress that can be caused by a natural form of dying. They provide nursing services, they provide social services, spiritual help. They also have caregivers that will come in and help with bathing once or twice a week and showering as needed. It's a lovely service. I hope that that when it comes my time, that it's not being shot jumping out of somebody's bedroom window, that I actually get to have a hospice nurse taking care of me and making sure I'm getting good pain control, and that my family's being taken care of. Because I think that all of us also go there and worry about who's going to take care of the caregiver once this is all concluding. I mean, once people are going through hospice and hospice care, it can, again, back to there needs to be respite care for the caregiver. You need to be able to step away, take a breath, do what you need to do in order to be able to restore yourself, to refill your cup. My agency and other agencies we're about to talk about will provide 24-hour care, but hospice does not provide 24-hour care. They may provide extended care over what a Medicare certified agency would, but they do not provide 24-hour care. And sometimes, especially towards the end, people need to be able to go to bed and know that their loved one is being watched over by somebody who's sitting by the bedside awake. And that can be managed and put into place through hospice. The other thing is that your own primary care, now that the healthcare system has changed so much, periodically people have their own primary care physician that's been their primary care forever, but those are becoming more like dinosaurs too, because of how our healthcare system is set up. So hospice actually has a medical director that is with them 24 hours a day, 7 days a week, and the hospice nurse has them available by phone, and they are skilled and specialized in end-of-life care. So that pain management and comfort management is at a much higher level than if you're having somebody who may care for a hospice patient, every 6 months or every 3 months, whatever it is. My preference is that when we're caring for people and they get to the point where they need hospice, I oftentimes will recommend that the primary care physician be kept aware of what's going on, but the medical management of the patient actually be by the hospice doctor, because they know what's available, they know how to get it, and they know how to get it done quickly. Always a difficult one.
This is a little apart from hospice.
That's okay.
Does your agency interface with folks who are on Medi-Cal?
Well, interesting you should bring that up, because one of the biggest things that was always a bummer for me was that I had to support myself, and then later on as added staff, my staff had to be paid for too. And unfortunately, some of the reimbursement from Medi-Cal was similar or less than what I was paying my staff. So I couldn't do that. But it happened. I'm really excited about this. There's a new program in Rohnert Park that we are working closely with. Actually, I'm on call for them today. It's called Age Well PACE. And Age Well PACE is actually an insurance company that only covers Medicare and Medi-Cal. And what they do is they have a physician, they have physical therapy, they have a daycare program, they provide all the medications, etc. And I just am loving it, because I feel like what they are doing is they are providing healthcare the way healthcare is intended to be. And we're just now starting an end-of-life care program, can't be called hospice, where we are providing caregivers through our agency for a lady who has a neurological disease that's end stage. And we transported her back and forth to PACE to be able to be in their day program. They have the ability to help people who might not have the resources to bathe and shower. And they send them home with healthy meals. They have a dietitian that goes to their home and helps them. And they have a pharmacy that provides their medication. Before coming here, I interfaced with a family who has a mom who has a urinary tract infection. I was able to contact the doctor immediately and be able to actually get the medication that she needed for a urinary tract infection, and made sure that all was streamlined. To me, that's the way healthcare should go. And if you'd like, I'll give you the number for Age Well PACE after this meeting. And anybody that, you or a family member or somebody in the community, I'll tell you what, this is the best thing since sliced bread that has happened in Medicare, in the medical community for the county of Sonoma in a long, long time. Long time. So I can't say enough about them, and I'm really pleased that my staff also now gets to work with them, and we also get to take care of that part that I wasn't able to do before because I have to charge for my services.
Mm-hmm. Yeah. Well, that's what we hear all the time. That's the difficulty is that Medi-Cal doesn't pay enough for agencies or even small care centers to be able to afford to use them.
Exactly. And this, I don't know how they're doing it. I know it was started, they have been opened for just a few months over a year. So it's relatively new. But I've got to tell you, one weekend I was on call, and my medical director also was working for them at the time, doing some respite for their pregnant doctor. And this lady called, and it's winter and it's raining and she doesn't have transportation, and she had an abscessed tooth and she needed assistance. So the doctor was able to call, do a screening. We ordered, he ordered an antibiotic to get her through the weekend. And my on-call staff got in the van, went over, picked up the drug for her, bought her some food that was going to be easier for her to eat rather than, fresh fruits and vegetables, some soups and so on. And the next thing that you know, She's got her medication, she had somebody who shows that she cares, and she was there. And she had her medicine, and they arranged for her to have dental care that week. That's what medicine should look like. I don't care if it's Kaiser Permanente, I don't care if it's Sutter, I don't care if it's Providence. To me, that's how healthcare should be. And now it's in our community. So.
What's the name of it again?
It's called Age Well Pace, and it's in Roanoke Park.
Age Well Pace.
Age Well Pace. I don't know why they picked that name. I would have called it something more mushy. I don't know. Sometimes I get the songs in my head from the 60s and think I should be out burning bras. So that's one of the ideas that came way back when, and now it's finally happening. So another type of care that's available, I don't know where we are with time. Am I talking too much?
We're getting to a place where we should start asking questions.
Okay. So do you want to start asking questions? Yes.
I have a question about the Age Well Pace. Is that just local? Is that
It's in Roanoke Park, but it's a national program. I don't think it's called Age Well Pace everywhere. But it started in San Francisco in Chinatown many, many years ago. And now it's grown and spread throughout the country. I'm really glad it finally came to Roanoke Park.
Is there a process for emergency respite care for caregivers who have a medical emergency?
I do not know of one. The other thing with Age Well Pace, just to let you know, that they have caregiving services, and which is inclusive of the program that they provide. Yes.
A question about long-term care insurance. You know, it was real popular years ago, and then insurance companies found out they overextended themselves. Are they still paying for services?
They are, but unfortunately, well, my experience has been with them.
Can you repeat the question?
Oh, I'm sorry. The question was about long-term care insurances, and are they still in effect? So they are. In retrospectively speaking, it would have been great just to take that premium and put it into a CD. You probably would have gotten more back from it. I'm seeing them pay $50, $60 a day for 24-hour care, when 24-hour care can cost you anywhere from $900 to $1,500 a day. Oftentimes they pay more in a facility than they do outside of a facility.
They're only paying like 10% of what the what the care would cost?
I had a client who paid into her policy $230,000, and she was she didn't tap into it until late in her life, probably the last 6 months of her life actually, and she actually was awarded about $50,000 out of the $230,000 she paid in.
That investment.
Yeah. I'm kind of the poster child for long-term care because we bought it early, and it actually paid over $700,000.
Nice.
And it was absolutely necessary. Probably we paid $40,000 in.
But that was back when they were real solvent.
Yes, but because they had issued the policy and we still had it, they still had to pay on it.
Oh, okay. Yeah.
And I'm not able to keep up with the kind of payments, premiums that they are now
Right.
raising and raising and raising to force you into lower quality policies.
Thanks.
Anything else?
Carry on.
Yes.
Yeah, the end of life with dignity, my ex-mother-in-law took that advantage in '98, but you have to have their criteria for doing that are pretty strict.
Well, the criteria for doing it is,
Can you repeat the question?
the question is about the strictness of the criteria for dignity with death. Theoretically, a person who would like to exercise their right for dignity with death has to have a diagnosis that would qualify them for hospice.
Yeah, but for example, one of the things is it's a liquid medicine, and if you can't swallow, and some Parkinson's people at the end of life can't swallow, there's no injectable program for that. There's just, if you can't swallow it, you're out of luck.
Well, that's right. So in the event that somebody has a gastrostomy tube or feeding tube of some sort, the situation would be they would have to be able to ingest it through that tube. There are lots of holes in the dignity with death. People with ALS, who oftentimes are very clear of mind and capable of making decisions, do not have the bodily functions to allow them to take the solution themselves. The solution itself is 5 different drugs, 5 different lethal doses, and it's about 4 to 6 ounces of liquid that has to be taken rapidly. So it's not, there are holes in the law, for sure.
Just another comment about the California End of Life Option Act. It has evolved over time to make it more possible for people to utilize it. And so I would expect there might be future improvements, and so pay attention to that.
That's right. That's very right. So if I can just, one more point that I wanted to make sure that everybody had the knowledge of, because it's something new that's happening in Sonoma County. It's probably happening everywhere, but I know Sonoma County. That is quite frightening to me. There are domestic registries, 1099 workers who are out there. They're quite gracious. They're very good caregivers. But with the 1099 worker, what that basically says is that you cannot be their employer. If you are their employer, that means you can't be telling them exactly what to do. Like if you had them come to your house, you could tell them to paint for you. You could tell them that you wanted the house to be painted yellow and provide them with the paint to do that. But you can't tell them what time to show up for work, and you can't necessarily tell them the length of time that they're going to be staying. It's a very intricate law. So one of the things that has happened recently is that there are these domestic registries, and there are private people who will ask you for a private hire. There are 2 cases I know right now that have recently been settled in Sonoma County where that worker has said after death, no, I was an employee. And a lawsuit has incurred, and the estate was sued for back wages, for overtime, taxes not paid where it had to be paid by the estate, and settled for in excess of $1 million. So when you look at prices that seem kind of extraordinary for people who are coming to you through an agency, think about that kind of a scenario. I've also worked with people who had the 1099 worker only to be pulled in through APS to discover that after a period of time, that worker's name was on the checkbook, that worker's name was on the deed, and isolation was occurring with family. So just be cautious. The caregivers are wonderful people. I love them dearly. There are just a few of them out there, I'm sure, that create hassles and problems like this. But we're all in a very vulnerable situation. We all have gray hair, and people think that we can be marks. So it just is really worth your while to be cautious and look for alternatives and look for guidance and assistance, especially when we're in those vulnerable times of crisis in our life. I thank you so much for allowing me to be here. I'm going to hang out if you want to ask me questions privately. My name and my number is at the top of the sheet that I gave you today. I don't want to walk away leaving you wondering. If you'd like, you're more than welcome to call. On the back table, there's a place where you can put your name and your email address, and I've left a little box for you to check if you'd like us to give you a call and talk to you about services that we can provide or other services that you might want to connect with in the community. And I hope that I get invited back because I just loved being with you today. So thank you for having me.